Have you ever walked into a room and completely forgotten why you went there? Or struggled to remember a name you've known for years? Most people blame it on getting older. They assume it's just part of life after 50. But what if I told you the real cause might be sitting right inside your medicine cabinet, and your doctor has never once warned you about it? Right now, millions of seniors across the country are taking medications they completely trust. Medications prescribed by doctors they believe in. Medications that, on the surface, seem perfectly safe. But here's what the research is now revealing. Certain widely used drugs, medications for sleep, heartburn, bladder control, anxiety, and even cholesterol, have been scientifically linked to accelerated memory loss, brain shrinkage, and a dramatically higher risk of dementia. In fact, a 2022 analysis tracked over 280,000 older adults and found that those taking a combination of these common medications had more than double the normal risk of developing dementia within 10 years. Double the risk. And the most terrifying part? Most of these seniors had absolutely no idea the drugs they were taking were doing this to their brains. In this video, I'm going to walk you through 9 medications that researchers and neurologists are now flagging as serious threats to your memory and cognitive health. Number 3 on this list is one of the most commonly prescribed drugs in America, and it's been silently shrinking memory centers in the brains of seniors for decades. Number 1 is the hidden danger almost nobody talks about, and it's probably happening to you or someone you love right now. Stay until the end, because what you learn here could genuinely protect your mind for the years ahead. Before we dive in, if you find value in health information like this, please consider hitting the like button and subscribing. It helps me keep making content that could protect you and the people you care about. It only takes a second, and it means everything. Now let's get into it. Picture this. It's 11 o'clock at night. You can't sleep. You reach into your nightstand and grab a pink pill, Benadryl, or a generic PM sleep aid. You've done it 100 times. It feels completely harmless. But inside your brain, something alarming is happening. Benadryl contains an ingredient called diphenhydramine, and it belongs to a class of drugs called anticholinergics. These medications work by blocking a critical brain chemical called acetylcholine, the very chemical your brain uses to form new memories and stay alert. Here's the problem. As we age, our brains become increasingly dependent on every drop of acetylcholine they can produce. When a medication blocks it, even temporarily, the damage can accumulate over time. A 2023 study published in the Journal of Geriatric Cognitive Health found that seniors who regularly used anticholinergic drugs had a 54% higher risk of developing dementia compared to those who avoided them entirely. 54%! From a pill you can buy at any drugstore without a prescription. Imagine it's 6 months from now and you're having trouble keeping track of conversations, misplacing your keys every morning, and feeling a fog that never seems to lift. You'd never connect it back to that pink pill you've been taking every night. But that connection is exactly what researchers are now making. Here's what you can do right now. First, check every label in your medicine cabinet for the word diphenhydramine. It hides inside products labeled PM, nighttime, or allergy relief. Second, if you need allergy relief, ask your doctor about loratadine, commonly sold as Claritin. It does not cross the blood-brain barrier and is dramatically safer for older adults. Third, for sleep issues, melatonin at low doses is a far safer short-term option. Never stop a medication suddenly. Always talk to your doctor first. But never assume over-the-counter means safe for your brain. If you're still watching and finding this valuable, go ahead and comment the word health below right now. It tells me you're serious about protecting your brain, and I read every single comment. Now let's talk about a medication that millions of seniors take every single day, often for years, without ever questioning it. Proton pump inhibitors, PPIs, like Prilosec and Nexium, are prescribed for heartburn, acid reflux, and GERD. They feel completely benign, just a little help for your stomach. But here's where it gets really alarming. PPIs aggressively suppress stomach acid, and your body needs that acid to absorb vitamin B12. B12 is not optional for your brain. It protects the myelin sheath, the insulating layer around your nerve cells that allows signals to travel quickly and accurately throughout your brain. Without enough B12, your neurons start misfiring, messages get scrambled, and the result looks almost identical to early Alzheimer's disease. A landmark 2016 study published in JAMA Neurology examined over 73,000 adults aged 75 and older. Regular PPI users had a 44% increased risk of developing dementia. But the problem doesn't stop at B12. PPIs have also been shown to increase the buildup of amyloid beta plaques in the brain, the toxic protein clusters considered a core driver of Alzheimer's progression. Imagine your brain as a highway. Amyloid plaques are like roadblocks piling up on every exit ramp. The longer you stay on a PPI, the more those roadblocks accumulate, and the slower and more confused your thinking becomes. What you can do. Ask your doctor whether you can transition from a PPI to an H2 blocker like famotidine, sold as Pepcid, which is far less likely to interfere with cognitive function. D-glycyrrhizinated licorice, DGL, is also a well-tolerated natural option that soothes the stomach lining without harming your brain. Now, this next part is what most doctors won't tell you in a standard office visit. Oxybutynin, sold as Ditropan, is one of the most commonly prescribed medications for overactive bladder. And that's understandable. Bladder control issues are uncomfortable, embarrassing, and disruptive to daily life. But oxybutynin works by blocking acetylcholine, the same brain chemical targeted by Benadryl. And unlike milder anticholinergic drugs, oxybutynin crosses the blood-brain barrier easily and directly impacts your hippocampus, the brain's memory headquarters. A comprehensive 2019 study in the British Medical Journal found that adults over 65 who took strong anticholinergic drugs like oxybutynin for more than 1 year had a 49% higher risk of developing dementia. Nearly 1 in 2 users. For a bladder pill. The damage is insidious because it looks so much like normal aging. Patients start forgetting appointments. They misplace everyday items constantly. They lose the thread of conversations mid-sentence. And no one, not the patient, not the family, sometimes not even the doctor, connects it back to the medication. Comment your age below right now. I want to know who I'm helping today, and I want you to know you're not alone in this. The good news is there are newer bladder control medications like mirabegron, sold as Mirbatriq, that work through a completely different mechanism and have significantly less impact on memory. Ask your doctor specifically about this option. Statins are among the most prescribed drugs on the planet. Simvastatin, atorvastatin, Zocor, Lipitor. Millions of people over 60 take them daily. They lower cholesterol, and yes, for heart disease prevention, the benefits are real and well documented. But here's what most people don't realize. Your brain is made up of nearly 60% fat. Cholesterol isn't just a heart issue, it's a brain necessity. It helps build and maintain the myelin sheath around your nerve fibers, and it plays a direct role in how efficiently your neurons communicate. When you aggressively suppress cholesterol throughout your entire body, you may also be cutting off critical fuel your brain depends on to stay sharp. A 2023 study in Frontiers in Aging Neuroscience found that seniors over 70 who had been on statins for more than 3 consecutive years had a 26% higher risk of mild cognitive impairment. High-dose users showed even steeper declines. Some patients describe it as sudden onset memory loss, a frightening moment where they can't remember a familiar name, a recent conversation, or a route they've driven for 20 years. But here's where it gets really alarming. Not all statins carry the same risk. Pravastatin and rosuvastatin are less likely to cross the blood-brain barrier and are considered significantly safer for cognitive health. If you've been on a high-dose statin for years and you're noticing brain fog or memory slips, that conversation with your doctor is worth having today, not next year. Benzodiazepines, lorazepam, diazepam, alprazolam, better known as Ativan, Valium, and Xanax, are prescribed to millions of seniors for anxiety and sleep problems. At first, they feel like a miracle. Racing thoughts go quiet. Sleep comes easier. Panic attacks ease. But over weeks and months, something shifts. These drugs work by enhancing GABA, your brain's natural calming signal. The problem is they progressively slow down neural activity throughout your entire brain. Your brain stops forming new memories as efficiently. It becomes rigid, confused, foggy. A 2022 study in the British Medical Journal followed over 8,000 seniors for 6 years. Those who used benzodiazepines for more than 3 months had a 51% increased risk of developing Alzheimer's disease. 51%. For a drug prescribed to help you feel calmer and sleep better. Seniors on these medications often describe feeling like they're watching their life through frosted glass. Present, but not really there. Functioning, but not really thinking. And the trap is cruel. When they try to stop, withdrawal hits hard. Severe anxiety, insomnia, agitation, making the drug feel essential when it's actually the source of the problem. If you've been on a benzodiazepine for more than a few weeks, do not stop abruptly. It can be medically dangerous. Work with your doctor to taper slowly over weeks or months. Buspirone, a non-sedating anti-anxiety option, and cognitive behavioral therapy for insomnia are proven safer long-term alternatives that don't chip away at your memory. Comment, "I had no idea" below if any of these have surprised you so far, because this next one shocks almost everyone. Amitriptyline, sold as Elavil, is an older antidepressant still widely prescribed today for nerve pain, chronic headaches, and insomnia. It seems versatile and helpful, a one-pill solution for multiple problems. But amitriptyline is one of the most potent anticholinergic drugs still in widespread use today. It blocks acetylcholine so powerfully that cognitive side effects aren't just a possibility. They are an expected outcome with long-term use. A massive 2015 study published in JAMA Internal Medicine examined over 3,400 adults aged 65 and older. Those who took high cumulative doses of anticholinergic drugs like amitriptyline over 10 years had a 54% greater chance of developing dementia. Even low nightly doses, taken over several years, can create a slow, invisible erosion of brain power. No dramatic warning signs at first, just a quiet decline that mimics natural aging, until it doesn't. Safer alternatives exist. For nerve pain, duloxetine or gabapentin carry far less anticholinergic burden. For sleep, low-dose melatonin is much gentler on the aging brain. For mood, sertraline or escitalopram are dramatically safer long-term options. If you or someone you love is on amitriptyline, please bring this to your doctor's attention this week. Paroxetine, sold as Paxil, looks modern and sophisticated on paper. It's an SSRI, the same class as Prozac and Zoloft. You'd assume it's safe. But here's the part most people are never told. Paroxetine is the only SSRI with significant anticholinergic properties. That one fact separates it from every other antidepressant in its class, and it makes it dramatically more dangerous for older adults. A 2021 review in Frontiers in Psychiatry found that paroxetine users showed measurable declines in short-term memory, verbal recall, and attention within just the first 12 months of treatment. Seniors on paroxetine were 30% more likely to show early signs of cognitive impairment compared to those on other antidepressants. The American Geriatric Society has officially placed paroxetine on its Beers criteria, a formal list of medications considered potentially inappropriate for older adults. That's not a minor footnote. That's a warning from the leading authority on elder care. The fix is clear. Ask your doctor about switching to sertraline or escitalopram. These antidepressants do not carry anticholinergic properties and are far better tolerated by aging brains. Supplementing with B12 and B6 can also naturally support mood and reduce dependence on antidepressants over time. This next one is deeply disturbing, and families need to know about it. Antipsychotics like quetiapine, risperidone, and olanzapine, sold as Seroquel, Risperdal, and Zyprexa, were developed for severe psychiatric illnesses like schizophrenia and bipolar disorder. But today, they are being prescribed off-label to elderly patients in nursing homes and hospitals, not for psychiatric illness, but for sleep problems, mild agitation, and restlessness. Often, they're used simply because they make patients easier to manage. A 2022 study in the Lancet Healthy Longevity followed more than 25,000 older adults. Those prescribed antipsychotics for behavioral symptoms were 71% more likely to experience worsening cognitive decline within 12 months, even with no prior history of dementia. These drugs also increase the risk of stroke, sudden cardiac death, and dangerous falls. The mechanism is devastating. Antipsychotics suppress dopamine, the chemical responsible for motivation, memory processing, and executive function. When dopamine crashes, the brain becomes sluggish and unresponsive. Seniors on these drugs often go from vibrant and engaged to dull, flat, and withdrawn within weeks. Families describe watching their loved one fade, physically still there, but mentally and emotionally gone. If a loved one in a care facility is on an antipsychotic, ask the prescribing physician one direct question. Is this drug medically necessary, or is it being used for behavioral management? Structured daily routines, environmental adjustments, and addressing underlying physical discomfort can manage most behavioral symptoms without these powerful drugs. You may have expected a single drug at the top of this list, but the most dangerous medication situation for seniors isn't any one pill. It's the silent, cumulative effect of taking multiple anticholinergic medications at the same time. Medical professionals call it anticholinergic polypharmacy. Picture a common scenario. A senior takes diphenhydramine each night for sleep, oxybutynin daily for bladder control, and amitriptyline for nerve pain. Each drug alone might cause only mild memory issues, but taken together, they compound exponentially, and the total anticholinergic burden on the brain skyrockets. A 2022 analysis published in Age and Aging tracked over 280,000 older adults and found that those carrying the highest anticholinergic burden had a 120% increased risk of developing dementia within 10 years, more than double the normal risk. From combining medications most people consider completely routine. When you block acetylcholine from multiple directions simultaneously, your brain doesn't just slow down, it begins to deteriorate. Neurons wither, synapses shrink, and the result on cognitive testing looks nearly identical to Alzheimer's disease. But here is the most important thing I want you to take away from this entire video. Drug-induced dementia is often reversible if you catch it early enough. When the medication burden is removed, many seniors regain significant mental clarity, memory, and energy within weeks or months. Your brain has a remarkable capacity to heal, but only if you give it the chance. What you need to do right now is simple. Ask your doctor or pharmacist to conduct a full medication review. Every prescription, every over-the-counter drug, every supplement, and evaluate the total anticholinergic load. Deprescribing is a legitimate, evidence-based medical practice, and you have every right to ask for it. Don't wait. Don't assume your medication list is fine just because no one has flagged it yet. This is completely preventable, and that makes it the #1 hidden threat to the aging brain today. Let's do a quick recap. Number 9, diphenhydramine, hiding in Benadryl and PM sleep aids, blocks your brain's memory chemical. Number 8, PPIs like Prilosec and Nexium starve your brain of B12 and trigger amyloid plaque buildup. Number 7, oxybutynin for bladder control directly damages your hippocampus. Number 6, high-dose statins may be cutting off critical fuel your brain depends on. Number 5, benzodiazepines like Xanax and Valium progressively sedate your memory. Number 4, amitriptyline silently erodes brain power over years. Number 3, paroxetine, the only anticholinergic SSRI, is officially flagged as inappropriate for seniors. Number 2, antipsychotics are being misused in care facilities and quietly destroying cognitive function. And number 1, anticholinergic polypharmacy, the combination effect, is more than doubling dementia risk in people who have absolutely no idea it's happening. Now I want to hear from you. Which of these 9 medications are you or someone you love currently taking? Has any of this surprised you? Drop your answer in the comments below. Your response could help another senior who's quietly going through the same thing right now. If this video helped you, please share it with a family member or friend. It could genuinely protect their mind. And in our next video, we're going to reveal the 7 daily habits silently accelerating brain aging after 60, including one thing most people do every single morning that researchers are now calling deeply alarming. Make sure you're subscribed so you don't miss it. Take care of your brain. It's worth fighting for.